Every year, approximately 12,000 females are diagnosed with cervical cancer in the U.S., resulting in over 4,000 deaths. 75% of cervical cancer cases are caused by strains 16 and 18 of the human papillomavirus, an STD. Gardasil, the first HPV vaccine produced by the company Merck, was put on the market in 2006 to protect against 4 strains of HPV, including 16 and 18. In recent clinical trials, the vaccination proved over 90% effective in reducing incidence of infection. When new vaccinations are put on the market, state legislation deliberates over which vaccines will be mandated. Should Gardasil be a mandated vaccination in the U.S., or should this be an autonomous decision?
The mandate of Gardasil received opposition from the public consumer. U.S. consumers value their autonomy. If the government is going to interfere with parental choice, then there must be a significant public health benefit. The government is infringing on sensitive parental choices because the risk is associated with irresponsible sex acts as opposed to casual contact. In addition, many consumers feel that the average $360 for a full 3-shot series is a waste of limited U.S. healthcare dollars. Since cervical cancer statistically affects poor women and minorities, why not spend the money on implementing affordable healthcare programs instead of financially burdening them with a mandatory vaccine?
Legislation for Gardasil was initiated in a way that made many public consumers wary because it was considered for mandate rapidly with little debate. Furthermore, the governor of Texas was the first to issue the mandate, and it was later found out that Merck was lobbying legislators in Texas and was contributing to the governor's re-election campaign. This controversy led many public consumers to believe Merck had a hidden agenda. The mistrust of Merck was sensationalized in the media and caused public consumers to revisit past experiences with Merck, such as the Vioxx recall.
Merck is in favor of their mandate because their company's values reflect improving human life. Their goal is to promote education of the link between HPV and cervical cancer. They plan to donate at least 3 million doses of Gardasil, as well as fund vaccine-assisted programs to help control HPV in underserved communities. Merck has good intentions with this vaccine, but they admit that the need for profit to continue research as well as fund their humanitarian endeavors. They also discontinue lobbying for the mandate in order to suppress controversy surrounding their company's values.
Since cervical cancer kills thousands of women, organizations such as the NIH and CDC recommend a proactive approach of prevention rather than a reactive one of treatment. According to the NIH, requiring Gardasil can assist in reducing cervical cancer deaths by as much as 2/3 around the world. NIH also reports this vaccine could reduce healthcare costs associated with abnormal PAPs that result in approximately $1.5 billion yearly. Additionally, insurance companies such as Medicaid would be required to cover vaccination if the government mandated it. A solution for people opposed to the mandate can opt out of the vaccine. Under popular misconception, mandating a vaccine does not force individuals to receive it against their will. Accordingly, 1 to 3% of children in the U.S. are exempted from mandatory vaccines on the basis of religion or philosophical beliefs. To override the mandate, a consumer must sign a consent form to opt out. Why should Gardasil be any different?
In conjunction with Gardasil's slogan,
Do you want to be one less